On this Thursday night, grocery prices taking a bigger bite out of your wallet. How much food costs are expected to rise next year?
It's going to be rough for everybody.
And what's fueling the inflation? Getting answers faster. The push to make rapid COVID tests more widely available. More than 500,000 surgeries postponed by the pandemic.
The orthopedic surgeon I talked to said, well, you'd be 3 to 4 years.
Where some patients are turning for their procedures. Plus, what's barged into Vancouver?
It's like a friendly new neighbor.
The fascination and fondness for this washed-up wreck.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with a rising cost of living in this country. Food is predicted to get even more expensive in 2022. Canada's food price report predicts prices will rise by up to 7% next year. That will push up the cost of feeding the average family of 4 to almost $15,000 a year, an increase of nearly $1,000 from 2021. And that estimate is based solely on the cost of groceries. It doesn't include restaurant meals. It's partly a sign of the times. The pandemic has disrupted work and created supply chain problems. We'll have more on that in just a moment. Our coverage begins with Ross Lord and a look at what's going up and how it will impact your family.
As the pandemic stretches on, weary Canadians face a new challenge, keeping up with the escalating price of food. Canada's annual food price report predicts record high increases for 2022.
It's going to be rough for everybody.
He's a senior. It's, we don't get that much. Oh, we get a CPP in old age. There isn't too much to live on,
The projected increases are hard to swallow. Meat up between 0 and 2%. Bakery products between 5 and 7%. And dairy up to 8% more expensive. Everyday staples that most Canadians already find expensive.
So 2022 is really going to be a tough year for people in the middle class and obviously families with less means as well.
Food prices were already up by more than 4% this year, with meat leading the way. Offsetting the additional increases means finding smarter ways to shop.
You have to really know your prices and shop around.
Buying frozen vegetables as opposed to fresh vegetables, or, price shopping or price comparison using flyers or coupons.
It seems bargain-hungry Canadians are already flocking to digital flyers.
As food prices rise on your high consumable items like milk, eggs, butter, bread, everything, we see an increase in search activity in general, but very specifically on those high consumable items.
With food banks already overburdened since the pandemic started, food researchers say the federal government should step up by helping ensure supply chain industries like trucking have the staffing to get food products to market in time, easing at least one inflation irritant. Ross Lord, Global News, Halifax.
To help understand what's driving up the cost of food and groceries, our senior business correspondent Anne Gaviola is with me. Anne, what are some of the factors contributing to this?
There's a whole confluence of factors coming together to push up the price of food. People have already likely noticed it, and there's more of it in the mail. So let's start things off with a look at the key drivers, including higher transportation costs, higher energy costs, feeding into all of that. We also have supply chain issues. These are pretty epic, the likes of which we haven't seen, certainly in my lifetime. We heard from the Deputy Governor of the Bank of Canada saying it's tricky to pinpoint when these issues are going to be sorted out exactly. We also have labor shortages. This is a global phenomenon, and it's also something that we're seeing right across the country, and that's impacting prices that you pay for food at the grocery store, as well as menu items and restaurants. And then a kind of fourth, final key factor, Donna, would be climate change. And this is something that's affecting food producers. They're dealing with more frequent severe weather events, and that's the kind of thing that's really tough to manage.
Yeah, so many factors. And there are ways to manage inflation, but I guess they come at a cost.
Right, and especially when you're talking about monetary policy, this is, of course, the Bank of Canada's #1 job is to manage inflation. The Bank of Canada is comfortable keeping it in a range between 1% and 3%. And what we've seen, certainly this fall, is that inflation has been running much hotter than that for many months in a row. And under normal circumstances, this would be the green light for the Bank of Canada to go ahead and raise rates. Right now, these are kind of uncertain times. The recovery is taking shape, but it's looking kind of uneven. So the Bank of Canada has telegraphed that we could see rate hikes starting as early as spring or summer of next year. And it's important to note those rate hikes, the goal is to kind of tame inflation, and they may have a more immediate impact on any debt that you're carrying. But when it comes to targeting and bringing down things like food inflation, well, that could take many more months.
Okay, Anne Gaviola in Toronto, thanks. Now to COVID-19. In Canada's two biggest provinces, the number of new cases is on the rise ahead of the winter holidays. In Ontario, more than 1,200 new infections were reported today. That is the highest daily caseload since May. The number of COVID patients in hospital remains relatively stable, though provincial health experts have warned hospitalizations are expected to climb, driven by people who are not vaccinated. Quebec also reported a spike in cases today, more than 1,800 new infections there. That's the highest daily total since January. The province says many of the new infections are people who are not vaccinated and children. Quebec hopes it can help curb new cases by distributing free rapid tests to all preschool and elementary school students. Children will be able to take the kits home and use them if they come down with COVID-like symptoms. As Michael Couteur reports, there is a growing push to make those rapid tests more accessible right across Canada.
Rapid tests are a good thing, but it's late in the game.
For months, Olivier Drouin has been pushing for widespread distribution of rapid tests for daycare and school-aged children. He's happy the Quebec government is sending each kid home with 5 tests, but
will not have any impact on the current outbreaks. There's over 400 outbreaks in elementary school right now with lots of community transmission.
Yet those tests still aren't widely available in the community. The federal government has handed out nearly 100 million rapid tests to the provinces, but according to Health Canada, only about 15% have been used. Uptake and availability differ across provinces. In Nova Scotia, the tests are more widely accessible.
Our mobile units through Nova Scotia Health have them there. If you go to get a PCR test, you can take some home with you.
Ontario has sent them to congregate living settings, private businesses, and areas of high transmission. They're also sending students home with 5 tests during the holidays.
We are distributing everything that we have, and over 1 million a week is a significant deployment of rapid tests.
Still, they're scarce elsewhere, even if you want to pay $40 for one at a pharmacy. And in Ontario, there is now a Rapid Test Finder Twitter page and the comical hashtag #FreeTheRats.
To be able to free those rapid tests from the warehouses that are storing all these millions of life-saving tests.
Compare that to the UK, where anyone who wants a rapid test can order packs of them online from the National Health Service. Antigen tests have an 81% accuracy rate. Still, some infectious disease experts believe wider usage would be helpful as people plan holiday parties.
A family gathering or something like that. If everyone has a negative rapid test before they come into the house, you have now added a significant degree of safety.
Health Minister Jean-Yves Duclos says he's met with his provincial counterparts to discuss increased supply and use of rapid tests, and he stressed they should be free for all Canadians. Michael Couteur, Global News, Ottawa.
We are getting a clearer picture tonight of the staggering impact of the pandemic on Canada's healthcare system. A new report from the Canadian Institute for Health Information found that since the start of the pandemic, hospitals performed about 500,000 fewer surgeries compared to previous years. That works out to, on average, about 35,000 fewer surgeries per month. Heather Yourex-West reports on the devastating impact of the delays and how long it will take to clear the backlog.
This happy little baby has no idea she's running out of time. 1-year-old Helen Dixon desperately needs eye surgery to correct her vision. Because of COVID, that surgery has been delayed.
She needs that before her second birthday to avoid any lifelong issues with her vision. We have no word as to when that's going to happen yet.
The pandemic has pushed back more than 500,000 surgeries across the country, and not all patients have seen the same impact. Over the course of the pandemic, hospital admissions for pregnancy and delivery remained about the same, while admissions for major cardiac diagnoses saw a bit of a drop. The largest decrease by far was for patients needing hip and knee replacement surgery.
The orthopedic surgeon I talked to said, well, you'd be 3 to 4 years.
Wow.
And I just deemed that to be unacceptable.
And so Tim Gibson decided to go private, paying $37,000 Canadian to have his hip replacement surgery done in Montana. The local provider there has seen a huge increase in demand from Canadian patients since the pandemic began.
I was just totaling my numbers for November, and I've had more than 100% increase in inquiries coming in. And our surgeries look to break the record as well.
Of course, not everyone has the means to pay out of pocket for timely care. To clear the backlog across the country, the Canadian Institute for Health Information says Canada's health providers will need a plan.
It's not only about money. It's about the workforce itself. It's also about our population and the population needs.
For Graham Dixon, what his daughter needs is clear. He just hopes she'll get that surgery before it's too late. Heather Yourex-West, Global News, Calgary.
In Scotland, people are being strongly urged to cancel their Christmas parties because of fears of the Omicron variant. Public health officials there say they've already seen a number of Omicron-related outbreaks linked to Christmas parties. They say early evidence shows the variant is much more transmissible, and they're asking people to defer their parties to another time. The Chinese government has a warning for countries that have decided on a diplomatic boycott of the Beijing Olympics.
进行政治操弄，不得人心。
A spokesperson for the Chinese government says Canada, Australia, the UK and the US will pay the price for their mistaken acts. Canada announced yesterday that government officials will not attend the 2022 Games because of China's human rights violations. China today dismissed the diplomatic boycott as a farce. A Quebec teacher removed from the classroom. Coming up, why she's been banned from teaching as parents and students voice support for her. Plus, BC sets another tragic record in the opioid crisis. A grade 3 teacher at an Anglophone elementary school in Chelsea, Quebec, has been removed from the classroom because her hijab defies the province's secularism law. Under the law known as Bill 21, teachers and public sector workers are banned from wearing religious symbols such as hijabs. A spokesperson for the Western Quebec School Board says it opposes the law, which was passed in 2019, but must follow it. Parents of children in the teacher's class got word of the change on Friday.
The children, to my knowledge, were not told directly as to why this happened, and we've been kind of grappling with our daughter and trying to explain the situation and why a law like this even exists. This is what will happen and will continue to happen to anyone that's part of a marginalized community in the province.
Supporters have been tying green ribbons on a fence at the school in support of the teacher, and federal politicians spoke out against the teacher's reassignment today in Ottawa.
It's important that laws that are unjust in provinces are challenged in those provinces. It sends a message clearly that the people of Quebec don't all support this bill and see a problem with it. And the fact that it's being challenged in court is the right thing, and it's going to continue.
The teacher has been reassigned to a role outside the classroom where Bill 21 doesn't apply. The opioid crisis in BC keeps getting worse. There has been another record loss of life from illicit drug overdoses. The BC Coroner's Service says a record 201 people died from a suspected drug overdose in October. That is more than 6 deaths a day. And so far in 2021, 1,782 people have died from drug toxicity. That's higher than the number of deaths in all of 2020.
An emergency requires an urgent response. How many more deaths are we willing to accept before we become comfortable with the idea of separating people from the toxic black market?
In November, the province applied to the federal government to decriminalize personal possession of illicit drugs. BC's chief coroner is also pushing for better access to a safe drug supply. Botched border measures ahead, how Canada's travel protocols fell short during the pandemic. The pandemic has focused attention on Canada's borders and the confusion over the rules intended to limit the spread of COVID-19. Now the Auditor General has found significant gaps in the testing and follow-up of travelers by the Public Health Agency of Canada. David Aiken joins me now with what the Auditor General discovered and why it matters. David?
Well, Donna, it's the second time that Auditor General Karen Hogan has looked at Ottawa's border control measures And this time she found that as recently as June, the Public Health Agency of Canada could not confirm the health status of tens of thousands of travelers.
This is not a success story. The agency's inability to confirm whether more than 1/3 of travelers complied with quarantine orders remains a significant problem.
Hogan looked at the border control measures that affected 2.5 million travelers arriving in Canada in the 12-month period ending June 30th. Now, she focused only on the Public Health Agency of Canada, or PHAC, and not on border guards or local health officials. Among her findings, while nearly 13,000 travelers were told to go to quarantine hotels, 326 never showed up, 71 refused to go, 45 left without permission, but just 13 tickets were issued. But even those stats may not be accurate because the Auditor General says PHAC had no proof, no record of stay for 75% of those who were sent to quarantine hotels.
It really is up to the Public Health Agency to do better at monitoring, at gathering data and following up in order to be able to demonstrate how effective these border measures are.
Perhaps more alarming, the government failed to match 30% of the COVID-19 tests it collected with individual travelers. And where there was a positive COVID-19 test, PHAC failed to follow up 14% of the time. That's more than 1,100 individuals who tested positive that PHAC never tracked. Now, as quarantine hotels and on-arrival tests are back on the menu to prevent the spread of the Omicron variant, the government vows to do better, mostly with beefed-up computer systems and wide adoption of the ArriveCan app.
A good and improving system is better than no system at all. And that's why we'll continue to do what we need to do, which is to put into place those measures to protect Canadians in the context of the Omicron variant.
But as the Auditor General noted, Donna, PHAC's work to improve those automated systems just started last month.
Okay, David Aiken in Ottawa, thanks. The Auditor General looked at other parts of Canada's COVID-19 response, including the impact on temporary foreign workers. You can find those details on our website, globalnews.ca/globalnational. In the U.S., the government's top road safety agency is investigating a complaint that Tesla drivers can play video games while the car is moving. The games, including solitaire, are played on the touchscreen console. The feature came in a software update to most Tesla models over the summer. A warning does pop up that only passengers should play while the vehicle is in motion. Tesla has long offered video games on its center console, but the original version could only be played while the car was in park. The National Highway Traffic Safety Administration says it is in talks with the company.
I'm Jordan Armstrong in Vancouver. Coming up, how a rusty old barge has become a local celebrity. That story just ahead on Global National.
Assembling Ikea furniture has become a kind of rite of passage to adulthood. And if you've gone through it, you know that every item at Ikea has a Swedish name. Well, Sweden has had enough.
When people hear the name Bolmen, few think about this beautiful lake in Småland, Sweden. Instead, most people think about this.
This new tourism campaign is reclaiming the names Ikea has borrowed for everything from toilet brushes to garbage cans. It intends to inform travelers the words are really names of places in Sweden. For example, Rimforsa isn't just a workbench, it's actually a small woodland village known for its tasty mushrooms. No assembly required. Well, in Vancouver, people are flocking to an unusual new site on the waterfront. Since a big storm a few weeks ago, a huge barge has been stuck along the seawall of one of the city's popular beaches. It's not exactly beautiful, but as Jordan Armstrong reports, many Vancouverites have grown strangely fond of it.
Vancouver is known for mountains, mild winters, and beautiful beaches. But one of those beaches is now occupied by a rusty wreck. Not that many are complaining.
Who couldn't like a barge? No, just because it's an oddball, you know? It's like, what are you doing here? Who invited you?
Well, no one did. The barge blew in unannounced during a windstorm last month. There was initially concern it would crash into the Burrard Bridge, forcing the span's temporary closure. But in the weeks since, the barge has settled in on the rocks of the city's West End, and several attempts to move it have failed.
It's like a friendly new neighbor in the West End. We want it to stay.
Some are even suggesting the barge be decorated for the holidays. The wayward vessel has spawned merchandise, musings, multiple Twitter accounts, and on any given day you will find people stopping to stare.
I have no idea why I'm fascinated with it, but hey, it's something different.
No, I guess the size of it, thinking about where it's come from and where it's going to go.
Of course, any big celebrity needs a full-time security detail, and the barge is no exception.
Sometimes people do crazy things, like jump from the top of this into the water.
Is this the biggest star you've protected?
I think so, yeah. That's the biggest star I protect.
But why is a city so starstruck by a barge?
You know, a little bit is the whole kind of selfie culture that we live in. It's like the perfect kind of selfie object.
Something fun for a sad, dreary time.
And with no firm timeline for the barge to say bon voyage, its presence will continue to make waves. Jordan Armstrong, Global News, Vancouver.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is the Christmas tree in downtown Stony Plain, Alberta. We'd love to see your Canada, especially festive and joyful pictures this time of year, maybe barges too. Please email yours to viewers@globalnational.com. Thanks for watching. I'll see you on Saturday for the new reality. Take care of yourselves. Bye-bye.